This is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice, one that provides personal, professional, and financial satisfaction.
Welcome to another episode of the Thriving Dentist Show. I'm Gary Takis, your podcast co-host. The title of today's Thriving Dentist Show is How to Determine if You Are Appropriately Staffed in Your Practice. You know, this is a question that I get very frequently in our webinars, from our clients, in our open mic sessions where they can ask any question. This is a common question that I get. And it occurred to me that many of our listeners may be thinking, you know, given that when we look at your expenses, the single largest expense item is staff compensation. So maybe you're thinking, you know, are you appropriately staffed? So we've got some good information to share with you about that today. Before we do that, I have two announcements to make. First announcement is coming up shortly after, about 2 weeks after this episode is published, is our very first masterclass of 2024. This masterclass is a different format than we've ever done. I'm partnering with my longtime friend and colleague, Janice Hurley. You may know Janice. If you're a listener to the podcast, you'll recognize her voice. But Janice is a very well-known expert in dentistry. We've been friends for a long time. We're doing a masterclass that's titled Mastering Confidence in Your Personal and Professional Life. 2-hour masterclass. It's on January 16th, 8 p.m. Eastern Time. Do the times translation. That'd be 5 p.m. Pacific Time. But come join us. Now, here's a twist on this masterclass. We're doing this masterclass to benefit a very important charity that Janice and I fully believe in. The charity is called Pastures of Grace. Pastures of Grace was created by Jennifer and Mark Clever. Jennifer is Janice's oldest daughter. And Jennifer and Mark are doing some very cool things. They own a ranch and a farm in Northern California. And Pastures of Grace is all about supporting young women in crisis. Sadly, there's a lot of young women in crisis. And what Pastures of Grace does is it helps these young women, very often they're young mothers, it helps them develop some great life skills, learn how to function, learn how to make great decisions, learn how to be a great mom, learn how to be a supportive parent, learn how to make good decisions in their life. Very often, these young women have been in a pattern of challenges and poverty and in some cases abuse. And it's hard to break those patterns. And Mark and Jennifer are doing some amazing work to help these young women live productive, joyful lives. And we're happy to support it. 100% of your tuition dollars will go to Pastures of Grace. It's very inexpensive. It's less than $100, but we're looking forward to helping fund their cause. And we're excited to do that. Would appreciate your support. Come join us. That's happening again, January 16th, 8 p.m. Eastern Time, Mastering Confidence in Your Personal and Professional Life. The second announcement I have is we have a returning guest contributor. His name is Dr. Jared Johnson, and he's going to talk about, in terms of pediatric dentistry, he's going to talk about how to use the SMART technique, silver modified atraumatic restorative technique. You're going to appreciate what Dr. Johnson has to say. With no further ado, here's Dr. Jared Johnson, how to use the SMART technique in your practice.
Hi, Dr. Jared here, and this week's tip is on how to successfully use the SMART technique at your office. So the SMART technique is a silver modified atraumatic restorative technique. It's very useful if you have a young kid that you can't get an x-ray on, but you can see an occlusal cavity, or maybe one of these 6-year-olds that is really anxious and you know you're not going to be able to get through treatment on the 6th-year molar. And how can we manage that without having to jump to sedation right away? So at my office, what our protocol is to apply the first round of SDF at that visit, and we will explain to the parents that we'll darken the tooth, and then we'll have them come back in 2 weeks for a second round application of SDF. We know that more applications of SDF increase its efficacy, and at that second visit, what we'll usually do if we have an area where we can get a glass ionomer to be retentive, we'll just go ahead and put that on the tooth and let that be a temporary restoration and reevaluate the kid in 3 months and work with them on those preventive visits to get more comfortable coming and get in the chair until we can get to the point where we're able to restore the tooth conventionally, or if it's a baby tooth, if it falls out. I hope this helps, and it's something you can implement at your office.
Welcome back to the Thriving Dentist Coaching in Action segment. This is Narain, your co-host. And this is our very first episode in 2024. So happy New Year, everyone. Hope you had a great Christmas and a great holiday season, and of course, enjoyed the 1st of Jan. So welcome to 2024. Before I jump into today's episode, I want to take a minute to thank two people. One is Jared Johnson for that wonderful tip, how to successfully use the SMART technique. I also want to thank Janice. Janice and Gary are doing this amazing masterclass. We are gifting all proceeds, like Gary mentioned. So I'm really looking forward to it, Gary. I'll be like at the front of the online class listening to it, because Janice is a dear friend, and I think the two of you would do this unbelievable job, and all proceeds go to the charity. So that's another plus. So thank you for that, Gary.
Yeah, I'm excited about it. Janice is a dear friend, and I love the work that Jennifer and Mark and their family is doing to help young women in crisis. A really noble cause, and they're amazing. Happy to support them.
And I love this topic, given that it's our very first episode in 2024, how to determine if you are appropriately staffed in your practice. How to determine if you're appropriately staffed in your practice. You know what? This is a question, Gary, I grappled with over the last couple of months as I was making plans for 2024. As you know, we have been growing quite a bit. I run a marketing company, Equa Marketing, and we help our clients get the right number of new patients every month through SEO and organic marketing. So just like we are helping them get the right number of new patients, we have to think about, given how intense the work is, like helping them dominate Google and be on top of Google for hundreds of keywords, given how intense it is, we have to continue to hire a large number of people, train them, and get them ready so we can keep up with the growth. So this is the question I grapple with. So Gary, I'm really looking forward to learning a lot from you today about how to make sure you're appropriately staffed. I know you talk about growing by 2 digits, at least 10% every year. That's kind of your wish for all your clients. I know some of your clients are growing even faster, like 25%, 30%.
Yeah, we're going to grow double-digit percentage growth every year, which yes, by definition means it's 10% or more. If it was 9%, 9 is a single digit. Right. 10 is double digit. So we want to grow by 10% or more. I know many of our listeners have adopted a growth mindset, and maybe even adopted the specific goal of growing by at least 10% every year.
Absolutely. So yeah, let's jump in. I'm really looking forward to this conversation about, are we appropriately staffed? And by the way, if you have a certain number in terms of new patients and you don't feel like you're getting enough, we would love to give to you a marketing strategy meeting to kind of come up with a marketing plan. That's equa.com/MSM, ekwa.com/MSM. But let's jump into the topic. I'm really excited about this topic, Gary, because I want to take some notes. So you might see me looking down and taking notes. So that's because I want to take some of your pointers and apply it in my business.
Well, this is a very important topic, and it's a common question that I get. As I mentioned, I get this question in webinars. I get the question when I'm giving, in-person courses, when I get it from my clients. We do some open mic stuff where it's, ask me anything,
yes,
AMA type format. It's a common question. And I want to give you a context to think about it. And Naren, you'll like this because you may not understand much about baseball, but there is a sport I think you understand cricket, right? Is cricket your form of baseball?
Yes. Cricket. Yeah. I love basketball. Those are like definitely basketball and cricket.
Well, maybe you won't get this, although Naren's a Canadian, so he better get this one right, or I'm going to be disappointed. He may have to give up his Canadian
citizenship
card. But Wayne Gretzky, the former Canadian.
Yes, he's no longer a Canadian.
No longer a Canadian. Although I think he kept dual citizenship. But
probably, yeah.
But Wayne Gretzky famously said when he was brought to Phoenix to kind of head up the Phoenix Coyotes, the Arizona Phoenix Coyotes, he was brought on every broadcasting channel, sports department.
Were you in Phoenix at the time?
Yeah. We were there, and I was excited about it. And of course, Wayne Gretzky, needs no introduction. But all the sportscasters would ask him, how in the world did you become the #1 scorer in NHL history? And at first he answered the question kind of coyly, kind of shy, like, well, I always prided myself on being very fit. I took my fitness very serious. I was always ready to play. And then he said, I also, prided myself on learning my skating technique. So, I could be very effective on the ice. And every time when they said, well, no, that wasn't it. No, that wasn't it. And finally he got to the right answer. He said, no, the reason I was able to score more goals than anybody else was I never skated where the puck was. I always skated where it was going. And that's such a brilliant response, Naren. If think about it, I don't know if you know much about hockey, Naren, but if you're skating where the puck was, by the time you get there, the puck isn't there anymore.
It's moving so fast, right?
It's moving so fast. Yeah. By the way, nobody can remember who the number 2 scorer in NHL history was.
Do you know who that is?
I'd have to look it up. Go Google it, Naren, just for Gordie Howe, maybe. See if my guess
I'll
is
Google
right.
it. Yeah,
I'll Google Gordie Howe. But anyway, people can't remember who was number 2 because the guy that was number 1, Wayne Gretzky, was so far ahead, nobody remembers who was number 2. But anyway, this applies to you and your practice. If we're trying to grow, you might want to skate where the puck is going, not where it is, which maybe we need to get ahead of it a little bit in terms of our staffing. I don't like to use the word staff, Naren, when I talk about team. Staff to me is either a stick or an infection. Okay, you spell the infection spelling a little bit differently. I like to think of it as our team. I believe the words we use are important. Maybe the better way to frame the title of this podcast episode would be how to determine if you have the appropriate number of team members in your practice. Maybe that's the way.
I found the answer, Gary, when you're ready.
Okay, who was it?
So, Wayne Gretzky is 2,857. And how is number 4 1850? So it's 2,857 versus 1850. Number 2 is, I don't know if I'm pronouncing his name correctly, Jaromir, Jaromir, and the last name is Jagr. And that's 1921.
I could have guessed that till I was blue in the face, and I never would have gotten that one right.
1921, but he literally has 1,000 points, almost 1,000 point lead on number 2, Wayne Gretzky. Yeah.
That's why nobody can remember him. At least I got in the top 5 with my Gordie Howe answer.
Yes, you did.
So for the Canadian listeners and the hockey fans, I hope I meet your approval by my hockey knowledge. So, all right, back to the topic at hand. How do you determine if you're appropriately staffed in your practice? Well, you want to skate where the puck is going, not where it is. But you have to be careful about it because your largest actual line item expense, that shows up on your profit and loss statement, is your team member compensation. That's your largest actual line item expense. And we've got to be mindful of that because you don't want to be overstaffed. You don't want to be overstaffed. You don't want to be understaffed. In fact, I like my own concept is I like a little bit of tension in terms of the number of team members. I would like to be slightly understaffed, but make sure that I have a budget to pay all my team members really well. Now, what would you rather have in your business in Equa? Would you rather have a bunch of people making average wages or lesser people making really great wages?
Bunch of people. You're asking me a trick question. Bunch of people making average wages or lesser people, meaning they're not up to par?
No, meaning that there's fewer number of them. Fewer number making really good money.
Oh, good question. I would choose option 2. I would choose
door number 2.
Yes.
Yeah. Because they'll be well compensated. They'll be working harder. They'll be really striving to help you achieve your goals. Yeah, I would agree. I would completely agree with that. So how do you determine? Well, there used to be formulas. I remember Linda Miles. Most of you remember the name Linda Miles. She was one of my mentors, continues to be a great friend of mine. Linda's retired now. She's in Florida, but she was one of the early pioneers in the world of practice management. And back then, Linda might give you a formula for determining that. If you're producing, you need a number of team members for this dollar amount of production. However, all that is a very antiquated way of looking at it because there's very different styles of practices. Very different style. If you're an everyday general dentistry practice, your need for staffing might be different than if you're a general dental practice, but more of your services are geared towards high value services. Might be a little bit different. So those generic formulas don't work. So I'm going to answer it economically for you. So I think it's maybe the best way to answer it. One commonality I've noticed, Naren, in my work as a coach, very often team members will say, the reason I don't get things done is I don't have time. I don't have time. The reason why doctor's schedule is not filled is I don't have time to fill it. The reason why our hygiene occupancy isn't where we need it to be is I don't have time to fill hygiene. The reason why our collections aren't where they need to be, I haven't had time to work on it. Now, I would politely suggest that that's the easy excuse for it. But what's really missing in your practice is your team members understanding their number one priority. What is their number one priority? You've heard me talk about the importance of having a hygiene scheduling coordinator. While you may have multiple administrative team members, depending on the size of your practice, I recommend that one of your team members be responsible for hygiene scheduling coordinator, putting butts in the seats in hygiene. Now, that individual may have many other duties that they do, but that team member needs to know that number one priority is putting butts in hygiene. Everything else is a lower priority, and they need to understand the priority so they're always spending their time and attention on the things that produce the best impact to your practice. And it has to do with accountability, has to do with creating accountability among your team members. And I'd be very cryptic about describing your expectations to that person. Like if you were hiring a new person as a hygiene scheduling coordinator, I would say to that person, you're going to have many duties and many responsibilities. We'll go over, the office manager will go over all of those with you. But I want you to know that your number one priority is keeping hygiene filled with butts in the seats. In fact, we measure that. We call it hygiene occupancy. And what that means is what percent of your available hygiene appointments ended up getting filled with a butt in the seat by the end of the month. We measure that monthly. And the goal is 92% or above. And that's your number one priority. And you need to know that everything else that you do falls lower on the priority scale. And then if you were interviewing someone, I would actually use this technique. I would say, tell me in your own words what you just heard me say. Naren, I'll put you on the spot. If I was interviewing you, number one priority is this. Everything else is lower on the priority. Naren, tell me, I'm putting you on the spot. We didn't talk about this. What, in your own words, tell me what you heard me say.
Yeah, I mean, I would repeat the number one priority. In other words, everything else is secondary. So this is the number one priority. And if I want to keep this job, I would make sure this number one priority is always, accomplished.
I'm going to organize my workflow so that's always my number one priority. I'm going to do whatever it takes to get that job done. Right. Well, if you gave me that answer, I'm going to give you a high five and say, great, you got it. And then I'm going to make sure we're supporting that in the practice, with the right support to make that happen.
I like this idea, Gary, because I think sometimes people say, "Oh, I was doing because I had to do the other thing. I didn't do this." They always it's like a juggling. They always use the other ones to say.
And the team will often say that, and we need more help. Yeah, we need another assistant. We need another sterilization tech. We need another admin team member. The answer almost always from the team member side is we need more help, but that's not necessarily the right answer. So I think the best way to look at whether you're ideally staffed is to look at what percentage of your collections, of your revenue, is going to payroll, going to team member payroll. And I use an all-in category, all-in. All-in means that everything related to team member compensation goes into that expense category. So all the various taxes, FICA, alphabet soup, FICA, FUTA, unemployment insurance tax, payroll service, matching 401k, whatever we do for a team member that counts as part of their compensation in the practice goes into that category. And ideally, that needs to be 28% or less, 28% or less. And when I give you a percentage, it means a percent of your revenue. So Naren, if you had $1 million practice, I'll use a round number because it makes the math easy. then
Yes.
your total budget for wages at 28% or less is how much?
$280,000. So it has to be
$280,000.
less than $280,000.
Now, that would not include any doctors. That would include owner doctor compensation, wouldn't include any associate doctor compensation. That's
What about a specialist who's coming there part-time?
that would not count as part of that.
Okay.
That your admin team, your office manager, your admin team, your assistants, your hygienists, if you have an internal marketing coordinator, anything related to that, that would go in that category, but would not include a doctor compensation.
But it would include all the, all the insurance and all the other extra expenses associated with the team.
Yeah, not the associates, not the associate.
I mean, with the non-doctor team.
Correct. Non-doctor team members, all of that, all in, whatever. If you fund their CE, that goes into that.
Let me throw a curveball, Gary. Let's say they hire a part-time person working from home or remotely. Would that include that?
Absolutely.
Okay.
Or if they're using a remote service, e-assist, for example, for verifying eligibility.
Yeah.
That counts as part of that because they're doing the work that a team member would, or they're using Support DDS, which we love.
Right.
Zimworks, Support DDS. There's other companies that do that. All that counts as part of that. So I think the best way to answer it is, can you afford to hire someone else? Now, if you're a practice, and I'll stick with that $1 million practice just because it makes the math easy. And let's say when you add up all the expenses, you're at 25%. You've got an extra $30,000 in your budget that you could spend on staffing. And now, if you follow me on that, if you're at 25%, you're 3% under budget. 28 minus 25, you're 3%. Every 1% in $1 million practice is $10,000. So you've literally got a $30,000 budget that you could use for staffing. Does that make sense, Naren?
Yes. Yes.
Doesn't mean you have to spend it on staffing, but you could. You have a budget for it. Now, there's times, and I've been in that position myself, where I haven't had a budget for it, but I've really thought that if I hired correctly, it's going to allow me to get where I want to go in terms of growth. So I make the decision proactively to spend on staffing with the gamble that it's going to allow me to be more productive. Does that make sense?
Yes. Yes.
Yeah, and that could be a good decision. Now, if we're adding a productive team member, a hygienist, that will pay for itself, because of the increased revenue that comes in for hygiene. So let's address this a little bit more specifically. How do you know when you are busy enough to support more hygiene days? You want a little bit of tension before you add more hygiene days. You want a little bit of tension between supply and demand. You want a little bit more demand than you have supply. A little bit more demand than you have supply.
What does it mean? Give me some specifics.
That so you are full in your hygiene schedule. That means demand.
Right.
Your hygiene schedule is filled.
So is it like booked out 1 week ahead? Like 2 weeks ahead?
So, we have to look at the number of active patients you have. It's a mathematical formula that you use. You look at the number of active patients, active as having had an appointment in the practice in the last 18 months. Ideally, our goal for what percent of our patients are in active recare, meaning actively engaged in hygiene, 85% or higher. It's not 100%, because you're not going to get 100%. It's not realistic. But 85% or above. So you can actually do the mathematical formula to figure that out. And you want a little bit more demand. So that way you have a call list, you have a waiting list. And if something opens up, you can go to that call list and fill it, because otherwise they'd have to wait a little bit to get the appointment. I want to be able to see new patients within a week of that phone call. Another way to look at whether you've got the right staffing. I want to be able to see a new patient within a week. If you cannot see a new patient within a week, it would maybe be worth, depends on your practice, it would maybe be worth the gamble, and I'm using gamble playfully, to add a team member to be able to support that growth as long as your marketing is working, because that's going to help your practice thrive. So there's always a little bit of tension there. But you can make that decision proactively. So it's kind of like you can either make the right decision in the example that you're at 25%, you've got a 3% budget. You can make the right decision, or you could make the decision right.
Mm.
Now, that wasn't a play on words. Does that make sense, Naren?
Yes. Yeah.
How
Make
do
the
you
right
make
decision or the decision right.
you make the decision right by creating growth culture within your practice? Maybe adding an assistant would allow you to do more same-day dentistry,
Mm.
and that could easily pay for itself. So maybe that would be a good example of making the decision right. By doing so, we're able to do more. We're able to serve our patients better, take care of them today, save them a trip, and the extra assistant allows us to do that. A lot of moving pieces here, Naren, but I want to emphasize that being appropriately staffed is critically important. You don't want to be understaffed. You don't want to be overstaffed. And you always want to skate where the puck is going, per Wayne Gretzky, to support the growth that you have. Now, I looked ahead. We've got some great questions coming up that's going to allow us to get a little bit more detail on this. But it's an important question to ask yourself, and it's important to use in your planning process in your practice.
Welcome back to the Thriving Dentist Q&A segment. This is Naren again, your co-host. The topic that Gary covered today is how to determine if you are appropriately staffed in your practice. I have 4 questions for you, Gary. I'm going to go through them one by one, and let's jump right in. Question number 1. I am a solo dentist with 2 hygienists in my practice. One hygienist works 4 days a week, and the other works 2 days a week. How can I determine if I have enough demand to add more hygiene days?
This is a great question. Like I mentioned in the coaching action segment, you want a little bit of tension between the number of days you're providing, the amount of demand you have in your practice. But the way I would answer that question is to look at 2 different variables. One would be, how soon are you able to see a new patient in your practice? And this would be a new patient, not in an urgent situation, not an emergency new patient. The type of new patient I'm thinking of would be something like this. Hey, I just moved to the area, and I decided I wanted to find a dentist near my new house. And I Googled the dentist in my area, and your practice came up, and I found your website. Everything looked great. I'd like to make an appointment. So in other words, nothing urgent, it's nothing happening today. So ideally, we want to see that new patient within a week, or at least we want to offer a new patient appointment within a week of the call. If you offer the patient a new patient appointment within a week, and they say, well, actually, I'm involved in a big project at work right now, I was thinking more like 3 or 4 weeks from now, then fine, go ahead and grab an appointment 3 or 4 weeks out. But we want to offer a new patient appointment within a week. So that's one of the variables that I would use in terms of that new patient appointment. Now, this does get into a side discussion of how do you structure your new patient appointment. And there's a lot of different ways to do this. Sometimes practices bring them in through the doctor's schedule, and they do a records and comprehensive exam. Other practices bring them in through hygiene with the doctor appointment at the end. And there's another way to do it, which is kind of a combination of records, doctor exam, and the hygiene appointment all done in one appointment. I prefer that latter approach. And in the hygiene appointment, we're either going to do a cleaning or debridement, depending on what the patient's periodontal health is. And I like that approach because, Naren, most new patients want to have their teeth cleaned. That's why they're calling to make an appointment most of the time. That's what they would like. I do agree that philosophically, always better to bring them in through the doctor's schedule, because then we could determine their periodontal health and we could schedule the appropriate hygiene appointment for them on a subsequent visit, because we don't know if we're going to be in a cleaning, a debridement, or maybe even doing some SRP, some scaling root plane. But the only problem with that is if you bring them in through the doctor's side and then subsequently schedule a hygiene appointment, you're not giving the patient what they want in that first visit, which is to have their teeth cleaned. So that's why I like the idea of that third option where it's combined. It's a comprehensive records. We get records needed. We do a comprehensive doctor exam, and then we finish that with a hygiene appointment that would either be a prophy or a debridement, depending on their periodontal health. So we want to offer that appointment within a week. And if you're out there 3 or 4 weeks, then maybe we can add a hygiene. We could add a couple days a week of hygiene, even a day a week, go from 6. So the way the doctor described that, 2 hygienists, one working 4 days a week, another working 2 days a week, I would call that my hygiene math would be 6 hygiene days a week. Maybe you go to 7 first, and then add an 8th day, when you expand to meet that need. But that's how I would look at that, is how soon can you see a new patient? And then the other thing I've noticed is that I said there are 2 criteria. The other thing to look at is how recently have you done a reactivation campaign in your practice to reactivate patients that are past due for hygiene? If it's been a while since you've done that, you probably need more hygiene days. So there's some ways to look at that. We don't want our hygienists sitting around, but we also don't want to not be available for new patients and not be able to reactivate people that are past due. So as always, there's a little bit of a balance there when making that decision.
Thank you, Gary. This is wonderful. I think you're getting into the nuances, and I think, like they say, the devil is in the details. So this is a great situation where, the details are really important.
Yeah.
I'm going to ask you question number 2. I am an owner dentist with a full-time associate dentist in my practice. How can I determine when to add another associate dentist? I hear this question even from our clients, Gary, like they're doing really, really well and they want to keep expanding. They're not sure if it's the right time.
Yeah. Great question. And very important to get that one right, because the number one reason why an associateship fails, now there can be many reasons why an associateship fails, Aaron. It could be personality, it could be style of practice, it could be practice, philosophy. But the number one reason why an associateship fails is the practice isn't busy enough to support the associate doctor. It's not busy enough. They don't have enough patient flow, enough activity. So you want to make sure you get this right. You absolutely want to make sure. Here's how I answer that question. This one's a little bit more straight line in terms of the determination. When your doctors, in this case, I'm using plural because I heard the question, there were an owner doctor and a full-time associate. Did I get that right?
Yes, you got that right.
So when the doctors are scheduled to goal 4 weeks in advance, that's when it's time to add an associate doctor. Now, notice the qualifier that I put on that. I didn't say just scheduled, but what did I say, Naren? Scheduled to goal.
To goal, yes.
To goal.
To goal, that's key.
So it's key, because if they're just scheduled and scheduling is sloppy and there's no attention to goal, then you may not have the demand. So you want to make sure, the criteria is when they are scheduled to goal. 4 weeks in advance, that's when it's time to add the associate doctor. Now, again, there are nuances. What if the additional doctor would bring services to your practice that you're not currently providing? Maybe the 2 doctors in this practice are not providing endotherapy, root canal therapy. And let's say the new doctor is skilled at doing a range of endodontic therapy. That might change the way I look at this, because you'd be providing services you weren't able to provide before. And maybe we could be a little less than booked 4 weeks out if the new associate doctor is bringing services that you're not currently provided. So as so many things, there are nuances, but there's some ways to look at that. I have had an interesting situation in my coaching that's come up more than a few times, Naren. And the situation is, Gary, I have the opportunity to hire an associate doctor that I think is so well suited to my practice. They fit like a glove. And man, I'd like to add, but I don't know if I have the demand. Naren, my own style of thinking on that would be to take the risk of adding a doctor that is so well suited to your practice. Take a risk in that. Doctor, maybe you reduce your clinical schedule a little bit, spend some time on the administration of your practice, maybe spend some time in CE. But when you have the opportunity to add an associate doctor that is a perfect fit, those people don't grow on trees, Naren. There is not a perfect associateship tree. If there was, I would grab all the seeds from that tree and plant them all over the country, but they don't exist. But when you have the opportunity to add someone that you feel like after your vetting process is such a great fit, I would be willing to take a little bit of risk in adding that associate because like I said, those people don't grow on trees. So a nuance to consider when adding an associate doc.
Thank you. Let me ask you question number 3. My admin team members need help keeping up with all the all the tasks they need to do. In my practice, what criteria should I consider to decide if I need another admin team member?
That's a tougher one because technically our admin team members don't necessarily add to our production in a straight one-to-one way like a hygienist would add or an associate doctor would add, and indirectly what an assistant would add. If we add a hygienist, we're adding more production. If we add an associate doctor, we're adding more production. If we're adding an assistant, indirectly, we're adding more production because we're allowing ourselves to be more productive in that role. But admin doesn't necessarily correlate one-to-one. They certainly correlate to the success of the practice, but it doesn't necessarily correlate one-to-one. So one of the things I would look at is, do you have the division of duties set up clearly? I like to have a specific doctor scheduling coordinator. If you're a solo dentist practice, specific doctor scheduling coordinator, a different person that's your specific hygiene scheduling coordinator. And then we could divide up the duties, the rest of the duties, which will number dozens and dozens underneath each one of those people. In the case of a 2-doctor practice, I'd like to have a scheduling coordinator for doc number 1, scheduling coordinator for doctor number 2, and a hygiene scheduling coordinator that are 3 different people. So another way to look at that. If you're not sure that there is enough work for an additional admin team member, you could take a look at things like, how are you doing in following up on those admin projects that are never urgent, but they're important? For example, have you recently done a hygiene reactivation project? Many times that's not done because the team member is so thinly staffed, the office is thinly staffed, they don't have time to do that. And you're sure leaving a lot of opportunity on the table. These are people that know, like, and trust you. We just have to get them back in the practice. Are we following up on unscheduled treatment plans? Many practices never follow up on unscheduled treatment plans because they don't have the time to do it. So there's a couple of tasks that if we put an admin team member on, they could greatly contribute to the success of the practice. The other thing to consider is, could you outsource some what I would call more mundane tasks? Can you outsource to third party to do some of the things like insurance verification if you're a PPO practice, claims submission, claims follow-up, those kind of things. And that could be done through a company like eAssist, or it could be done through outsourcing to a company like Support DDS. So in some cases, you don't need a full-time person, but if we could outsource some things that are a little bit more tedious, CRM is a buzzword today. In practice, or I should say RCM. I mixed up those letters. RCM, revenue cycle management. It's a buzzword today in dentistry, and what that means is everything related to collections, everything related to cash flow in the practice. RCM. Could you outsource some RCM functions through a third party that is very skilled at doing those and could do those on a part-time outsource basis? That could be a good solution for the practice, so that your team members in the office are primarily responsible for taking care of the face-to-face team members, face-to-face patients in your practice. So again, a lot of variables there, but I've given you some things to look at. You don't want to be understaffed. I'll give you an example, Naren. This happened prior to COVID, but I remember in 2019 when I was traveling to a conference in Boston, the conference hotel was at just a wonderful hotel. It was a Four Seasons in Boston, and everything about the hotel was first class. The quality of the decor, the quality of the appointments, the quality of the furnishings in the room, the thread count. Naren, who knew about thread counts, Naren? But the quality of the cotton, the thread count on the cotton sheets. But every time you called the front desk to ask a question, nobody ever answered. Never. It just rang and rang and rang. Never went anywhere. Never went through a message tree or anything. And then if you decided to go downstairs to talk to someone, there would be 8 people standing at the front desk with no one at the desk. What do you think my experience was of, now the facility was A++. On a 5-star rating, I'd give it a 5+.
Mm-hmm.
What do you think my experience was in terms of service?
2 thumbs
Pretty
down.
poor. Yeah, poor.
Yes.
Yeah. So you don't want your office to fall into that where you don't have time to answer the phone. Here's a good way to check that. Here's a really good analytical way to check that. What % of the time during office hours does your phone go to voicemail during your office hours? Naren, one of the benefits of being an Equa client is you can tell me that. Equa can tell me that at LifeSmiles.
Exactly.
And if that's happening, then maybe you take the risk of hiring someone because you are leaving money on the table. Your marketing's working, your phone's ringing, but you're not answering it.
Yeah.
And if
I
any of
mean,
you are thinking, oh, that doesn't happen in my practice, unless you have the data, and I'm talking about hard data, not opinion, unless you have the hard data, you don't know. And, schedule a marketing strategy meeting with Equin. They'll show you how they do that. So you have hard data and it's not an opinion that you have.
absolutely,
Great
Gary.
question.
So one of the things we track is what's called missed call percentage during office hours. So if a practice is missing, let's say, we recommend don't miss more than 5% of the calls during office hours. But if a practice is missing, let's say 25% of the calls, both new patients and existing patients, remember, new patients will not call back. They will go to the next listing on Google and call that office instead. So that alone will kind of pay for at least some
could
of
pay
the.
for by itself.
Yeah,
That
exactly.
could actually pay for that team member. Of course, that team member is going to add lots of other value to the practice as well. That's why you don't want to be understaffed.
Right.
You don't want to be overstaffed. You don't want to be understaffed. It's a balance for sure.
Absolutely. And if you're looking to get more new patients, book that marketing strategy meeting Gary suggested, equa.com/MSM. Gary, this next question, the last one, the fourth one, I can see a little bit of fear in the person who wrote that question. So I'm sure you're going to address it because I know you hate, people who are afraid of things. So you're going to give them some
Yeah,
confidence.
you don't want to make decisions based on fear.
Yeah. And by the way, you are doing your first masterclass on confidence. So I guess this is a great place to practice that. Anyways, let me jump in. I currently need more hygiene days in my practice. Good thing. However, I'm a listener to your Less Insurance Dependence podcast also, and I'm planning to resign from many, in this case, several PPO plans in 2024, and even go all the way to fee for service. So this doctor has a lot of dependence on PPO, and he's just saying, you know what, 2024 is the year I'm going to do something. I might even go all the way to fee for service. His question is this: should I wait to add another hygienist until after I resign from PPO plans to see how many PPO patients I lose? So he's afraid of the patients he might lose.
Yeah, it's a great question. It's a very fair question. I get it. I've heard that many times in my coaching work. Hey, I don't know. I'm worried about the fallout. I think I'm going to sit on the sidelines and wait and see what happens.
Right.
But if you know you currently need another hygienist, then you're not serving your current patient base. It's also likely that you're not very available when it comes to conservative periodontal therapy. If you have no time to put in regular patients in your hygiene schedule, where are you putting your SRPs? And that's important because if we get the patient excited about, taking care of their gum health and they're motivated to get appointments, it's like popping a balloon if they go, to schedule those appointments and they can't be seen for 3 or 4 months. You're taking all the motivation out of moving forward with that treatment. So I would suggest, based on past experience, and this is universal, meaning all the clients we've worked with from a coaching standpoint, many clients have had that fear. And what we found is they've lost some patients, but they've lost way fewer than they ever imagined. And they never had to cut back on hygiene days. We've never had to cut back on hygiene days because too many patients fled the practice. You would be the first one. I doubt that that's going to happen if you do your planning right. So I'm going to be an optimist. I'm going to be an encourager. Add those hygiene days because that's going to serve your practice now. And if you do everything right, you do everything in your prep, you're going to discover that you're going to lose some patients. There's no sugarcoating that. But it's not going to make a difference in terms of needing to cut back hygiene now because you don't have enough hygiene demand to support that. We've never seen that happen. when you do everything right in your prep? Great questions today, especially. Well, as we come to the finish line today, hope I provided some useful information so that you can determine whether you're appropriately staffed in your practice. Very important detail to master. You don't want to be understaffed. You don't want to be overstaffed. You want to be right staffed. And also, we want to grow. We want to grow by at least 10%, double-digit percentage growth every year. That'd be at least 10%. Something to think about. Well, as we're publishing this near the beginning of the year, let me use this opportunity to wish you an amazing new year. Here's to 2024 being your best year yet. We provided some information for you to take some action on today. Let me encourage you to take action. And let me also conclude by thanking you for the privilege of your time. If any of your colleagues could benefit from the information on the Thriving Dentist Show, tell them about it. They can find us on iTunes or wherever they get their podcasts, and invite them to be a listener. We always welcome new listeners, and we appreciate your support. Again, thank you for the privilege of your time. Naren and I look forward to the next Thriving Dentist Show, and we look forward to helping making 2024 your best year yet.